Good afternoon and welcome to the Health Shift. Today we have with us Chelsea Hoffman, who is our Main Street Manor supervisor. But before we get into talking to Chelsea today about Main Street Manor, go ahead and give us a like and subscribe to our YouTube channel and like us on social media and share the different shows that we do. This is an opportunity for you to learn about the different resources, services, and providers at Russell Regional Hospital. So first of all, welcome Chelsea.
Thanks, Janae. Thanks for having me.
Yes. Tell us a little bit about your role at Main Street Manor as the supervisor.
Well, I am actually in charge of staff supervision. I assure that the staff is doing what they can to take the best possible care of their residents. I do a little bit of the back end work too, so I'm busy in the office usually getting everything turned in for Medicare. But other than that, I'm making sure that the residents are the best taken care of by our staff that they can be.
Great. And what is some of the prior experience that you had that led you into long-term care?
So, Janae, I started out right out of college as a CNA. I started right when I was taking my classes to be a nurse. I started as a CNA, and I've been doing CNA and LPN work since probably about 2010.
Okay.
And then as I got my nursing license, I dabbled in a little bit of other stuff, but I always get drawn back to long-term care.
Great. So. And what are some of the services that Main Street Manor now offers?
We offer quite a few services, and some of it people don't even know about. We offer both long-term care placement and short-term care placement. A lot of people don't realize that we offer short-term care. Short-term would be more of your people coming out of the hospital who have a goal to go back home but aren't able to at the time. So we offer them to come into our facility, use our therapy services, and hopefully get the strength they need to go back home. With the long-term, we offer area that they can stay at that is similar to home so that they feel a little bit more comfortable. So we have that, and we have activities. We have a family style dining services, and we have a beautician that comes once a week and offers hair styling for the women.
And there's lots of fun activities I've noticed too, celebrating birthdays and holidays, and also just getting the residents active in different activities.
Yes, we have a good activities program. We're working on making a great activities program. We want to start taking them to the VFW to do bingo once a week. We want to start getting them out there in the public because that's what they did before they came to see us. So we want to get them out there and let them have as much fun as possible. So.
Great. If you have a family member that you think is going to need long-term care in the future, short-term, long-term, what are some of the first steps that a family should take?
Well, what I hear a lot is that people feel like they didn't have any help when it came to this. So I always encourage people, if you're looking at long-term care placement, to give us a call, meet with our social services designee, meet with myself, and we can help you get set up with the proper financial channels. We can help you get set up with social workers, whatever we need to do to get you to make that transition a little bit easier for everybody.
Okay, great. And what are some of the unique benefits that Main Street Manor offers that maybe other long-term care centers don't offer?
So what's really neat is that we're in a hospital, so we're able to offer everything that a hospital can offer, but in a home-like environment. We have doctors on call 24/7, right, and they come and see the patients probably more than they would at another long-term care just because they're here and they're able to. We have physical therapy, occupational therapy, and we're in the same building. So if a resident needs to use the heated pool, for example, in therapy, they can just walk down with therapy and use that. We have a masseuse on staff for the hospital who's willing to come up and work with the residents as needed. And we have a lot of things that is unique to our long-term care.
Great. And you also provide a teaching role in the community. Tell us a little bit about that part of your job.
Yes. So I recently partnered with NCK, North Central Kansas Technical College. I am teaching a CNA class at the high school. I have about 7 students right now. I think it's really important to have that aspect in the high school. Due to the COVID pandemic, we lost a lot of healthcare workers.
Yes.
This gets the younger generation interested in healthcare, and it opens the door for not only nursing, but several other jobs in the healthcare field.
So if a student completes all their credentials, can they go right from high school into a job? usually? Or
yes.
okay.
So they can have an entry level CNA job if they complete everything, but also the high schools are starting to offer college credit hours along with the CNA class.
Okay.
I know that when I went to nursing school, I went to school with people who went from high school to nursing school, which is awesome. They had everything that they needed done before they graduated from high school. So.
And what has been your favorite part so far of working in long-term care and teaching CNA classes? What really stands out as a highlight for you?
Honestly, my favorite part of my job is my coworkers. I think it's awesome to see people who are so dedicated to their job and the people that they serve. We're all kind of like a little family up there. We cry together, we laugh together, and we're there for the same purpose, which is serving the residents.
And you've really become part of their family too. I see that as well.
Yeah.
Yes. Okay, so if anyone has questions about Main Street Manor or CNA classes, what is the best way for them to contact you?
So I just encourage people to call the hospital, and you can ask for me, and they'll send you up to Main Street Manor. If you want to just stop by and visit Main Street Manor too, I'm there Monday through Friday until about 4:30 usually. So
okay,
I'm always around.
Anything else you'd like to add?
I don't think so.
Okay.
Thank you for having me.
Sure, thanks for coming. Okay, thank you for joining us today for the Health Shift, and be looking for more episodes in the future.